Hello everyone. We are
Hi.
here today to discuss about how to become pregnant naturally. So we have three of our doctors here. Dr. Chandana Lakireddy, ma'am has almost 25 plus years of experience and she's the chief doctor here. And we have Dr. Srividya who has 12 years of experience, who is an senior fertility specialist, and Dr. Chandani. She is also one of our fertility expert here. So we will try to gain as much knowledge as we can. If you're wanting to become naturally pregnant, if you have more doubts, probably you can leave your questions in the comments, and we will try to address all your questions. Okay. So, hi doctors, welcome.
Hi.
Hello. Hi.
So we're going to ask you a lot of questions to understand about a little bit about how to become pregnant naturally, because I see a lot of people saying that they're not able to become pregnant naturally these days. Pregnancy has become quite a challenge to many people. So I wanted to know if there is anything that people can do, any changes within themselves so that they can try becoming pregnant naturally. And then if things doesn't work, yeah, of course you're all there to help them. But till then, I wanted to try understanding a little and also help our audience to get all their questions sorted. Okay,
Sure.
so the first question is there a specific age, doctor, like which age is right age to become pregnant? Maybe Chandana ma'am, like with your
Yeah,
experience,
yeah,
have you?
sure. I mean, right age, I think we had one webinar recently, like what is the right age? So, what we said or what we always encourage our patients is the sooner the better. Whenever they think about the pregnancy, that is the right age. Because we know, like, I mean, the fertility declines with the age, both in the males and females. So, I mean, minimal, I think what we are looking at is 22 plus. But after that, whenever they're ready, yes, probably go for it. And if they're like late marriage, whatever, I think they need to be even more conscious about the effect of age on the pregnancy, and the sooner they plan. Again, same thing, like this is the minimal. I think maximum also something we need to look at, because the chance of downs babies and I mean miscarriages, all this goes high with the mother's age. So like if there are anyone like planning for pregnancy over 40, 42, I think there is still a chance of natural pregnancy, but we need to be very careful when they conceive. Like an extra support and extra monitoring need to be done. And if we do IVF for I mean, advanced maternal age, we do recommend a test called PGT, which is like pre-implantation genetic testing of the embryo, so that we can see
Okay.
if there is any genetical errors in the baby even before we implant the embryo into mother's womb.
Okay. Okay. Nice. Thank you, doctor. And like when you're telling me, is there any specific time frame where patients can try naturally? Like if they have to try intercourse, is there a specific time duration of the menstrual cycle, or in a month, what time they can try? Uh, Dr. Srividya, can you help us with this?
Yeah. Actually, there is one period called fertile period. It is the period when that ovulation happens. So many couple actually they don't know. They think that we are trying since 6 months, 8 months, and then but we are not able to conceive. But in women, it is like egg releases 14 days prior the next cycle. So that is called as fertile period. That is around 14th day. Okay, if you count like her cycle is 28 days, ovulation happens in and around 14th day. So that time is very important. Okay. So what we tell is from if their cycles are regular, like from 8th day, 10th day to 18th day, better to have intercourse at least every alternate day. So that is the period what we call as fertile period. If couple is trying for pregnancy, and then so even though like everything is normal and then their health, everything is normal, they think that why we are not conceiving. So many people they miss that fertile period because of this busy schedules and all. If you are planning for pregnancy, better to stay together during that time. So at least to have intercourse or at least alternate day, because half like when egg releases in our body, it stays in our body around like 24 to 48 hours. And then lifetime of like sperm also, it is 24 to 48 hours. So that's why that period is very important. That
So
time,
is it
if they
gonna
have,
be the same? Is it gonna be the same time for everybody, or it differs from person to
no,
person, the
it
fertile
differs.
period?
That's why we are yeah, it differs. If they have irregular cycles and all, it differs. So that's why if they have irregular periods, and then if they have PCOS, that ovulation when it happens, it is a little bit difficult. For them, if they come to hospital, we do the follicular monitoring, follicular study we call. We will do like around like from the second or third day if they come, one baseline scan. After that, after 1 week, one scan, and then we will tell them when is the time for ovulation. So that is the
Okay.
important time. Even though if everything is normal, that is very important period.
Okay. Thank you, Dr. Shiritya. Dr. Chandni, like if we follow this specific age and the time, I mean, the fertile period window, how fast can one person become pregnant? I mean, will they be pregnant in the first attempt or first month?
That is a question no one can answer in this whole world when they will fall pregnant. But there are certain guidelines which we can follow when they're trying naturally, provided their cycles are regular, they're having fruitful intercourse. Many couples also have problem in intercourse. They should be having fruitful intercourse in which the semen has to be entering the female genital tract. And if they're meeting around the fertile period, many of the couples, most of the couples get pregnant within the first 1 year. Around 80%. Another 10%, around 90% will get pregnant in the next year only, in the second year. So that is why the cutoff, whenever we say when is the right time to meet an infertility specialist, is after 1 year of trying and you still are falling pregnant, then you should meet with the specialist to see if you need any further tests that can help you. So this arbitrary 1 year can be reduced to 6 months also in women who have already known issues if they're more than 35 years of age. Because once if we cross 35, the eggs start falling down faster. So if they're more than 35 years of age and they have some known issues like PCOS, irregular cycles, or some issues in the man, it's better in 6 months only they meet a doctor. Otherwise, 1 year.
Okay. Thank you, Dr. Chanu. Chandna ma'am, like I've seen a lot
Yeah.
of people trying for pregnancy and then pregnancy not happening for them, and then they start becoming so much anxious.
Yeah.
Or there are few people who don't want to plan it now, but then they're anxious whether it's okay to wait for certain point of time. So, is there something that you could do for me to know, like if it's okay to wait or we should plan
Sure.
immediately? Like how can a person know about it?
Yeah, yeah. I mean, there are certain tests actually which we are nowadays, I mean, encouraging more and more. They're called fertility screening. It's there both for the males and females. So in that we do like different types of tests. Mainly we focus on how is their general health and also like how is their fertility potential. Is it like okay according to the age, or I mean based on which we can give them the time frame. So in that, basically for the females, we'll do certain hormone tests, certain general medical tests, and probably one ultrasound to understand her uterus and ovaries. And then in detail, we do the counseling based on their reports. If required, probably one genetic counseling as well. And for the males, we mainly do this semen analysis in which we'll get to know their sperm count, movement, and the healthy sperm percentage. And probably based on that, if required, an ultrasound and hormonal and general medical tests for the husband as well. So once we see all these reports, we can, guide them in a correct way based on where they stand. If everything is good, like I mean, they can always delay things according to their medical condition and the age. If not, probably we can give them a certain time frame in which they can, I mean, sort of try to plan things. And anxiety, stress, I think always you are there to help them out to choose the right path. So we take help of psychologists as well over there.
Yeah. So you do certain tests, screen for them, and give them the time frame of how much time they have to wait.
Correct, correct.
It's
Fertility
nice.
screening or a pre-conceptional counseling is very much needed. so that they will
Correct.
not have that much of anxiety as well. Otherwise, whoever actually defers their pregnancy, they're always worried what's happening with my eggs, how is the sperm, whether I took the right decision. Once they do this, at least they know that okay, fertility specialist has done this. I know things are okay. I can wait. If not, if there
Right.
is a serious problem, yes, I can sort of give them an advice to make things work faster.
Right. I think it's also better to have all the knowledge in hand before you postpone it.
Correct, correct, correct.
Right. Okay. Thank you, Doctor. Dr. Srividya, you were mentioning about the timed intercourse, what time you have to do and stuff. Like, how does it work if in case somebody is irregular with their periods?
Yeah, if they have irregular periods and all, then better to come to hospital once, because we have to evaluate them why that periods are irregular. Okay, is there a major issue or some minor issues why their periods are irregular? Okay, because nowadays so many people they think that irregular periods means PCOS, PCOS, PCOS. So many doctors also gynecologists without doing scan also they are labeling them as a PCOS. But we are seeing as a fertility specialist so many patients who have low ovarian reserve. That means their follicle number, egg reserve is less. They are also having that irregular periods. So first better to come to the hospital. So we do one baseline scan and then we will see, and then baseline evaluation of thyroid and prolactin hormone, why their periods are irregular. Okay. And then if everything is normal, if we think the problem is mainly with the ovulation, so one way we can track the ovulation. Okay, we can do the scans and then like we will tell them when is their ovulation time and then when they can have like intercourse. So that is the one way. And then if they don't have that time and then if they don't want to come to the hospital, roughly we will assess the time like fertile period if their periods are irregular. But if it is too irregular, we cannot assess. If it is like around 35 to 45 days, then we can tell them this is the safe period and then you can try. But at least alternately they should have the intercourse.
Okay.
Okay, that is 14 days prior to their next expected date that ovulation
Okay.
happens. And then other methods are there, some basic methods like they see like basal body temperature, and then some people they check with the like LH strips and all, and then they are not so accurate. But if they want to conceive and then if they have irregular period, if they come to clinic, we will help them. Just basic scans like follicular studies, it takes just 5 minutes. So they can
Okay.
come and then have one scan, and then when follicle is growing, when they are ovulating, we can help them and then we will tell them this is the best
Okay.
period, this is the safe period and best period to have the intercourse. That's why we will increase the chances, but it is not like that so many people that okay ovulation happened and we had intercourse 100% we conceive. As Chandini told, it is not like that. Even though everything is normal, if they are trying for pregnancy, it is like 20 to 25% people conceive in 1 month. Like it is less than 20% if we speak. So if they are constantly they're trying for 6 months, the chances will increase. It is like that.
Okay.
And I think nowadays there are so many apps as well. We'll be
Yeah.
surprised to see the types of apps people will be carrying to, keep a track of their period, to keep a track of their ovulation, whatnot. Probably few of them are reliable, but they should have a basic idea like how Dr. Srividya mentioned. The last 2 weeks post ovulation is fixed, means like
Okay.
they have to calculate based on the period expected date 2 weeks back. That is the best method rather going for the apps and urine tests, urine strips, because sometimes that actually creates anxiety, because if it app
Correct.
is not right, or if this urine things they're not sensitive, they will be just creating anxiety, and that itself leads to problem with the ovulation.
Right. And there are a lot of people these days using ovulation kits.
Yeah, that is
Uh,
that
how
urine test.
effective-
Alleged.
yeah. Like I have seen one of my friend sending me photos every day saying it is light, it is dark. It's almost like a pregnancy confirmation of whether it's positive or negative kind, but it is all about ovulation kit. Like how accurate is ovulation? Like is it better to come get a scan done, or is it like better to go with this kits of ovulation?
Probably Srividya can add.
Yeah, because that kids actually that result changes on so many things. If they have any like urinary infection, also that report will change. So many things, and then so many changes in our body also. Like because of that, also that report will change. So better to it is not so accurate, but people think take it very seriously, and then they will have so much of stress. And then instead of that, better to have one scan, come and have scan. We directly see whether they are ovulating or not. That is direct test instead of like indirect test. That
So
is better
those
than
have
ovulation test.
become popular, I think, because of the West. In the West, they don't have access in US, UK to the doctors as readily as in India. When we have the best and we can confirm ovulation for sure with scan. It's better to do this than go for urinary tests, which are not that accurate.
Right.
Yeah. Thank you, Dr. Chandni, for adding to it. And is it like, suppose I come to the hospital and get a scan done, is it not going to be natural pregnancy for me, or is it going to be natural?
It is going to be natural because we are not going to do
There's a
anything
lot
to the
of questions to ask me.
it is going
I
to
see
be
a lot of
natural.
people. I see a lot of people getting stressed, saying that it's not a natural pregnancy. It's not happening naturally for me, and I had to take a lot of medicines and I have to come for scans every time. It's now not natural. So, what do you think about it, Dr. Chandani?
That is a stigma a lot of people unfortunately have, even very well educated couples seem to be having this notion. But a follicular study is follicular study is nothing but seeing the egg growth and telling you when to meet according to the egg release, that is ovulation. That is all happening naturally in the body. We are not assisting it, we are only detecting it. So it is very much equal to a natural pregnancy. And even
Okay.
using
So, I
ovulation
think.
also is natural pregnancy. It that is not assisted. ART is different. It is itself in the definition. This is all natural. Even using medicines for egg release to regularize your cycles is also a natural pregnancy. And these are very minimal things which can help people attain natural pregnancy. So they should not shy away from such medicines.
So I think you people will be helping them through some
Yeah,
help, as little help to become pregnant naturally.
that's
Yeah.
all. Yeah.
Right.
That's nice. Okay. So I've seen a lot of people not wanting to plan pregnancy now, and probably they want to use some contraceptive pills. So are these contraceptive pills gonna affect their chances of pregnancy naturally later, Dr. Chandni or Chandana ma'am?
No, contraceptive pills won't affect the chances of getting pregnant naturally later, but taking them for a long time is also not advisable because they don't suit everyone, and you should have a safety profile for using those medicines. Because in contraceptive pills also there are different varieties, and one suits one disease and the other one is safe for everyone. So even for that, meeting with a doctor, taking a fertility checkup, like madam said, do a screening depending on your condition, because even we can prescribe medicines to use. Depending on that, we can suggest what contraceptive pills to use, and they will not affect your future pregnancy.
Okay. But if in case you're using contraceptive pills, and how, I mean, like, when should we stop and then when should we plan again for pregnancy? Like, what should be the duration gap between stopping it and trying again?
There is no duration. As soon as you stop the pills, your body is back on track and they'll start producing eggs again. So once your 21 days, usually it's given for 21 days of periods of tablets are over, you can stop. If you stop in between without completing the course, you will get periods frequently. So it's important to complete the
Okay.
course.
Okay. Uh, is there a specific diet or some food which increases chances of pregnancy?
Yeah, I think this is most commonest question asked by all our patients as well, or the couples in our clinic. I mean, what we all tell is there is nothing specific, but all the healthy diet is what we are looking at to boost up the fertility chances, whether it's in the husband or the wife. Basically, try to have a lot of protein and avoid like carbs and fat, and try to avoid outside food, And homemade, I think anything is good. Having lot of water, fruits, veggies, and nuts, sprouts, all this is what we encourage them to do. I think nowadays the most, challenging thing is to avoid outside food, because I think with all the Swiggy and everything, it has become an easy option. And lot of people, like working people, they do, have like outside food quite often. So if they can just work on it and try to have a healthy homemade food, which have more of proteins, I think salads, that should be good enough. Nothing else.
Okay. Doctor, when you talk about the diet part, you're saying overall it is better to have a healthy food rather than any specific thing. But there are certain movies that showcase, like if you're eating papaya or things like that, you'll have a miscarriage. So, is it true that you're not supposed to eat something when you're planning for pregnancy?
See, these are all not that much scientific based, but in general, we do advise like to avoid certain fruits, that too mainly after the treatments, like when there is a chance of pregnancy. Basically, papaya and pineapple are the only fruits we ask them to be cautious. But in case if someone had eaten that, we don't think it is going to really cause a miscarriage straight away. But whenever possible, better to avoid these two. Otherwise, I think any food they're allergic to, like any fish, prawns, they should not try new things when they're pregnant. Like the ones which they have been already taking, they're quite used to it, that they can continue.
Okay. Okay.
Yeah.
Thank you, ma'am. And Dr. Srividya, like when you're generally when people are planning for pregnancy, they try to take too much rest
Yeah.
because if in case I'm pregnant, maybe I'll have a miscarriage. So, can I do exercises, or can people do exercises if I'm planning for a pregnancy?
Yeah,
And if I have to
definitely.
rest, when?
Actually, definitely you can have regular activity if you are trying for natural pregnancy and all, because that will actually regulate your hormones in your body, that activity. And then that is very important also. And then so many people think that I am trying for pregnancy. If I move, like some abortion happens and all, and then finally what happened? They will gain weight and their periods will be irregular later, and then they will be in under stress. Don't do that. And then better to have regular exercises whatever they are doing. Like if they are coming for any treatments and all, definitely we will tell them like when to decrease activity. We also don't tell completely take bed rest, even though after doing IVFs also we never advise completely take bed rest and all. And better to have regular activity, and then regular exercise whatever they are doing, and like half an hour to 45 minutes of exercise, that is always good actually. Whatever is like if they are doing like vigorously, that okay, after ovulation periods few days they can have regular activity. If they are doing more of too much of gym, they can decrease a little bit. That's it, but they don't need to stop activities, walking and all they can continue,
Okay,
because
so
they
they
are
can
trying
continue.
yeah, they because they are trying naturally. Sorry, something you are asking.
No, they can continue all the activities, but they have to reduce the intensity of it if they are doing vigorous activities.
Yeah, vigorous activity after ovulation period, that is important because that is the time when implantation happens. But minimal walking and then that and all they can continue exercises and all.
I think another common question people ask here is climbing of the steps. Whether we
Yes.
can climb steps when we are trying for baby, when we have fallen pregnant, it's absolutely fine. Not everyone can shift to ground floors or they're trying for pregnancy. It's absolutely fine, but they should not fall. They should not slip when they are pregnant. That is more important rather climbing the stairs.
Okay. Okay. Thank you, Doctor.
Even for
Dr.
IUIs
Chan,
also. Yeah,
yes, go
even for
ahead.
IUIs also, after IUIs so many people ask that question. When and then they will take leave for 14 days till their UPT test. Don't do all the things. It is like absolutely fine to do regular exercises also. That is, those are all minimal treatments.
Yeah.
Right. Thank you. Dr. Chandni, I was just thinking about the food habits. Like, Madam was telling me about a specific food. There's no specific food as such, but I've seen a lot of people asking me, and there's a saying from our olden days: not to eat chicken, not to eat chapatis
Heat.
and all, which produces heat in the body.
Right.
Yeah, this is why even egg is not allowed for many people. So, can you explain about it?
See, for a human body, anything in excess, not only heat, not only cold, is not good. We should have a balanced diet of everything. So for the amount of rice and for the amount of chapati we eat, that should not cause any problem. Say suppose someone is eating some 14 chapatis per day, okay, maybe they will have some effect because of the sheer amount of food they're eating. But that should not affect their body temperature or our hormones in any way. Anyone, we should be taking a balanced diet. A proportion of your carbohydrates, protein, and fat, and vitamins and fiber should all be in the balanced form. And eating chicken is absolutely fine, mutton is absolutely fine.
Okay.
All of these non-veg items are good.
Okay. So this is going to
And
be a good news to many people then.
yeah, so in the meat
Only for the
section,
non-vegetarians.
Yeah.
yeah, yes,
No,
people
because
who love.
I've seen a lot of times in counseling sessions also, either husband or the family members generally keep saying you should not touch non-veg at all because it produces heat to you. So it a lot of times women take it as a pressure, or they feel like they're not able to eat something they want. But then sometimes I also think, where are they getting protein from then? Like if they're not able to eat from vegetarian, if they have to only eat something that they don't like, then how will they be happy and produce any happy hormones in them?
Correct.
That's
Only
a
one,
valid.
yeah, only one thing is they should reduce little bit of oils and then masalas in that. And then if they are eating the non-vegetarian from outside, better not to eat that preserved items. Unless otherwise, that is the very good protein they can always have.
So anything in moderate is okay.
Yeah, and this heat concept as well, again, a common thing people are worried about. My wife have like a body, I mean, which is very much heat. I mean, few people in fact ask me when I touch also, I feel it is very hot. Is that going to reduce the chance of natural pregnancy? Not really. I mean, having like, I mean, heat in the body, it's not detrimental for pregnancy. It just tells us they have a good blood flow. That is the natural body condition. That should not affect the chances of getting pregnancy or any success in the treatments we do either.
Okay. Is there any lifestyle modifications that one should do when they're planning for a natural pregnancy at home?
Yeah, there is some natural like lifestyle modification. Like one thing is if they are having sedentary lifestyle, better to have like moderate exercise. If they cannot do for like every day, at least 5 days in a week. That is one thing. And then diet, already we told so many things about the diet, those modifications. And then smoking, it is bad news for who is smoking, and then better to stop the smoking because it will affect semen and semen count and all. So better, and even egg quality, smoking and alcohol, like once in a while they can take, but better to reduce the amount what they are taking. And then regular physical activity which helps them, like which keeps their hormones under control, that is very important. And then stress always, if they are under stress, they have any problem, I will send to you only. So that is
Yeah.
one thing which is very important, because that will also like changes hormonal balance in the body, and that is also very important. These changes they have to do.
Okay. Thank you. And Dr.
Sleep
Chandni.
as well, no? I think we do see a lot of people nowadays having issues with the sleep somehow. I think it's because of their shift system, working for the US companies. I think they're unable to sleep, get that at least minimal of 6 to 7 hours. I think that is also something people need to work on because that can actually, I mean, chronic sleep loss can have effect both on sperm and the egg. Probably they need to work on either changing the shift, or if not possible, at least in the daytime they should manage to have 6 to 7 hours of sound sleep.
Okay. I mean, that 6 to 7 hours should be continuous, doctor?
I mean, if possible, that will be the best. I mean, like having 2 to 3 hours, I mean, intermittent, it's not going to give them like good relaxation.
I think this is going to be a major problem because of the lot of people are working for US shifts or UK shifts and
Correct,
all, and
correct.
then
Yeah, yeah.
uh, and night times they can't sleep,
And in
or
fact, the system actually sometimes reduce the chances of their natural pregnancy, because few of our patients, they do mention that because both wife and husband working and both having different shifts, they hardly have time to meet in that fertile period. So
correct.
that way
Yeah.
also they actually delay the natural pregnancy.
So I think sometimes wife will be in the morning shift and husband will be in the
Correct.
night shifts. For
Yeah.
them, meeting and talking only will be a problem. Then planning for pregnancy becomes
Yes.
even more challenging.
Yeah. Yeah.
Doctor, if in case I was pregnant naturally for the first time and then had a miscarriage, what are the chances of becoming pregnant naturally again?
The chances are very high as before only. So the only thing, whenever there's abortions, especially in repeated abortions, we should try to get terminated medically. Suppose there is an issue and you have to be aborted, then try to go medically or be under a supervised doctor who will keep fertility also in view in their, in the future, because DNC, that is curettage, which we do, was very rampant before. Nowadays little awareness is increasing, so they clean the uterus with some kind of an instrument. That should not be done too vigorously, because then that might affect your future pregnancy, even in natural or in any other treatments also. But otherwise, them falling pregnant again should not be a problem.
Okay. Thank you, doctor. Dr. Chandna, ma'am, like I've seen a lot of people becoming pregnant, but then it turns out to be an ectopic pregnancy. So, if in case they have an ectopic pregnancy for the first time, how easy is it to become pregnant naturally again? And if so, what kind of precautions they should take?
See, if they don't have any other fertility issues, I think they have a fair chance to fall pregnant again naturally. But they need to be very cautious, because once they got the ectopic on one tube, there is a high risk of having the same problem in the another tube as well. Because this usually happens because of the infection in the tubes, which comes from below, and both the tubes are attached to the uterus. And it might be like in one tube it got manifested and the other tube eventually might have the same issue. So when they fall pregnant as well, probably in doctor supervision and early scans to see where exactly the pregnancy is formed in their second pregnancy, to assist them with that. Because the earlier we detect the ectopic, the best will be the treatment. Because if we wait for advanced stage, sometimes there is a chance that emergency might happen and the tube might rupture. She might end up in an emergency laparoscopy. So the earlier we detect, it is good. But if it is repeatedly happening, and if in any of the tests we did, there is an infection in the other tube as well. So how we get to know is by doing one ultrasound or a test called HSG, in which we pass a dye and see if the other tube is working fine or is there any infection. Then
Okay.
probably it's better to avoid natural pregnancy, avoid the fertilization in the tube, and go for an IVF pregnancy, because that is the only safer way, or that is the only treatment in which we can totally avoid the tubes.
Okay. So they have to be very conscious to know when
Yes.
they're
Yeah.
pregnant. They have to be very
Yeah.
cautious.
I mean, lot of people, they do conceive naturally after ectopic within normal pregnancies. Just that we need to be cautious and they need to be properly counseled. Any pain or
Okay.
any bleeding, anything happens after pregnancy, they need to seek medical advice straight away.
Okay.
Yeah.
They just can't wait till the scan, or wait till 2 or 3 weeks time.
Symptoms before the scan. Yeah.
Okay. Thank you, doctor. Dr. Srividya, if in case someone wants to marry within the family, and do they need to go for any kind of pre-counseling because of the chances of any genetical problems,
Yeah,
or
definitely.
it is okay?
Actually, yeah, definitely. Actually, nowadays, the incidence of consanguineous marriage is decreased. But even though if they want to marry, better to do their like basic karyotypings and all. And then if they have any genetical issue in the family, and then better to take care about that, because if they have genetical some conditions will be like autosomal recessive and dominant we call, that will be like if they are autosomal recessive, that condition is if they have only one gene, that like features and symptoms won't be manifested in that couple, like that person. But when they marry in the family, there is always the chances will be increased that next baby will have that genetical problem, because one gene will come from mother, one gene will come from father. If they both have that gene, if they both are like carriers for that gene, that will carry into the next like generation. There is 50% of risk. So that's why always we ask like if that couple have any history of consanguineous marriage, any family history of diseases, all those things, genetical problems. So that is why it is very important genetic analysis in that couple. And then there is increased chances of abortions also if they have like consanguineous marriage in family, and then if they are going for that, the chances of miscarriages will be increased. So that is also they have to think about that. And all those things we, how much ever we can rule out with the karyotyping and all, and then we, if they have some specific problem, some other specific genetic tests also we do, all those things we can do and then see. But if
Okay.
possible, better to avoid families with the marriages within the family because of all these issues.
Okay. Yeah. I mean, like I don't know if it's a blessing or no. If in case someone is in love, then they would be always having this problem of what will happen with the
Yeah.
kid later.
Yeah, actually,
So,
recently one couple we have seen in clinic, and then in our center, and they had like consanguineous marriage, and then they in family one genetical disease which related to the kidneys, that is running in the family. They just came for the fertility screening. Actually, they
okay.
thought like they will just do basic tests and all, and then it already that female is affected with that, and then they have that problem in the family. That is the condition, and next generation it will be manifest early. If father is having symptoms at 40 years, daughter will be having symptoms at 20 years only. If they have that disease, that is that much serious disease. They don't even know about that, and then after they just came for just semen analysis and then basic test for her. Then after
Okay.
seeing all those history, I asked them like, do you have genetic test? Anything is done? And then so many people they don't even know that with IVF treatment and all we can test the embryos, and then like embryos which are safe, which don't carry those genes, we can transfer, and the next generation at least we can save next generation. So many people they don't even know this option. Actually, we have to like I think so many people we need to give them awareness about this. So fertility screening is and this counseling like preconceptional counseling, that is why it is very important. We can see all this history, and then if any specific thing we can do, and then we can help. So then that couple actually we advised, because this is the option. There is an option is there. You can go for IVF, and then we can screen the embryos. They are coming next month for the IVF because they want to save next generation. Yeah,
So
those things.
I think ART treatments are like a blessing, at least for the next
Yeah,
generation.
next
Can help
generation.
them rule out this problem.
Yeah.
That's nice. Okay. What kind of test do you do, doctor? I mean, like maybe Dr. Chandni can help us.
I didn't get your question. What kind of test can be done on the baby?
Yeah, I mean, like maybe not the baby before conception
Okay,
to avoid any
preconception.
genetic problems. Yeah.
Yeah. So in preconceptual counseling, first and foremost is screening of both the partners to see how fit they are for pregnancy, and also if they have any problems which can be causing causing infertility, which is making it difficult for them to conceive. And the other one is like Madam said, from history we can reduce if they have any problems in running in the family, which have to be screened. So for that, various tests are there. For fertility screening, Dr. Chandana ma'am already elaborated, right? So those tests will be there. And when it comes to the pre-pregnancy workup, there's a normal screening hormonal profile like thyroid, prolactin, sugars, and their complete blood picture. When it comes to this preconceptual counseling as such, they'll draw a pedigree chart and see how common can the disease be in the family, how common can it be in the next generation. So these tests will depend on the disease they have. Few of them can be detected in karyotyping, Few of them, the specific test has to be done, like a whole exome sequencing has to be done to detect that gene. So that depends on the condition which we are suspecting in the couple. So everyone will not have the same kind of tests. Depending on the history, we will have. But the common test which everyone will have is the fertility screening. That is important. And not only test in preconceptual counseling, we can also advise about the lifestyle changes. According to the lifestyle they're following right now, we can tell what changes can be done. And any prenatal vitamins that have to be started. Few of them will be deficient in vitamin D also. So these vitamins we can supplement.
Okay. Thank you. Dr. Chandana ma'am, like,
Yeah.
if a person is overweighted and their BMI is quite high, will it affect the chances of them becoming pregnant?
Yeah, definitely. I think overweight and obesity does affect the chances of natural pregnancy. The same with our treatments as well, success. So wherever possible, we do advise to first concentrate on weight loss. But it again depends on at what stage they are. Like, I mean, we have evaluated and we have seen their egg number is quite low. And if I ask them to go away for 6 months, 1 year, because weight loss is not something they can achieve in 1 to 2 months, then probably by the time they come back to me, if their eggs are totally gone, I think it doesn't serve the purpose. So we have to always balance things and see. If everything is fine, egg count, sperm, they're planning after 1 year, 2 year, we have the time. Yes, I think they should go for a weight loss, that too in an gradual manner. We don't want something like an acute weight loss and the same thing will be rebound back again. So something we are looking at around 2 to 2.5 kgs per month with the combination of exercise and diet, because lot of time we see people go for an extreme diet plans that is not like an healthier way of losing the weight. Should be combination of exercise and the diet, and but have an healthy diet rather totally, I mean, going on fasting and all this stuff or taking a pills. Lot of people ask us, is there a pill which can help me with the weight loss? There is nothing like a magic or a miracle pill we can give to make them slim straight away. And that is not actually a healthier way of losing weight as well. So they need to go for this and then probably we reevaluate after 6 months to see how is the progress, and depending on that we can advise.
Okay. So they should have a healthy weight loss and definitely it will
Yeah,
impact on their pregnancy. Yeah. Okay. How
correct, correct.
about people who are underweight, doctor?
Underweight also detrimental for a natural pregnancy. So BMI, the ideal, that is the height to weight comparison, we are looking at between 18 to 25. We do get people who are under 18, 17, 15, very lean. For them, we encourage to, have a healthy diet again and a little exercise. It doesn't mean that they should not be exercising. So they should exercise, have a healthy diet, and probably they cannot have like big meals. For them, frequent small healthy meals is what we advise. And then probably eventually, I mean, if they are able to achieve over the time, that is also gradual. They cannot go for junk food and all that and gain 10 kgs in 2 to 3 months. That is not going to help us with the pregnancy.
Okay. Thank you, doctor. And there are certain questions from the audience, so
Okay.
we'll try addressing them as well.
Yeah.
So, Dr. Srividya, maybe you can answer this. You have mentioned previously that it is better to reduce consumption of alcohol, and occasionally is fine. So, how how frequently they can take?
How frequently means that amount also important, how much they are taking also, not only frequency. And then once in a week, once in 15 days is fine, not daily. Okay, weekends like
Okay.
once in a week. And then better to avoid during that fertile period, because there is no scientifically proven things that it will affect the semen and all. And then that it is not like that immediate effect it will be there on the semen. It is like long term effect, but better to avoid during that time. And then once in a week is okay. There is no cutoff for that, but that is fine. But smoking, no, no, no.
Okay.
I think binge
Completely.
drinking is also something they should not do. So having too much of alcohol in one day, I
Yeah,
think that is also
that is also
have
not good.
negative effect. Yeah.
I think a lot of people take coping strategies, negative coping strategies. Either they eat so much, or drink so much, or smoke so much,
Yeah.
and that would affect their fertility.
I think they
Okay,
should
you
choose
have
alternatives and see the counselors rather going for all this.
good. Okay, you have one more question here. If the partner is having health problems before they plan for pregnancy, is it gonna delay their pregnancy? They did not specify which health problem. So, if they have
So
any health problems, probably.
like I mentioned, like in the beginnings, when a partner has one of the partners already has a known medical condition, it is better to get it under control, especially those which deal with hormones which can affect our reproductive capability, like thyroid, sugars, prolactin, and these hormones are important for ovulation and also sperm formation. So these tests have these conditions have to be kept under control before trying, but not it's not like they will directly affect their chances of natural pregnancy. There is an indirect relation, but it is always better to keep them under control and then try for natural pregnancy, because when the sugars are not under control and the HbA1c, which is an indirect marker, is really high, they might have chances of going for abortions even if they fall pregnant. See, getting pregnant might not be difficult for few, but they might have chances of miscarriages. And if they have hypertension and then they get pregnant, the hypertension might exaggerate in pregnancy, so that will have its complications. So, because of these implications, it is better to meet with the fertility specialist or their doctor who's treating them and take their opinion.
We have one more question, doctor. My wife has recently gone through endometriosis surgery. Can we try naturally, and after how much gap can we try?
See, endometriosis surgery, again, the surgeon who has done should give them a plan. If it is like a mild form, usually there is no need of taking a gap. They can start trying naturally. But if the condition was moderate to severe, probably we need to look at like going for any assisted conception options like an IUI or IVF. Because with endometriosis, there is always a chance of recurrence, and so we don't want to wait for that condition to come back again and again. They need to go through the surgery. So better like whoever has done the surgery to give them a proper plan. If not, they can always come to the fertility specialist based on their operative findings, and with certain blood test and the scan, we can see where they stand and how is the fertility potential, and then we can advise the time frame for the natural pregnancy or to start any treatments.
Thank you, doctor. There's one more question. The patient was saying, my wife, she's at the age of 25, but when we visited to the doctor, they said her menstrual cycle is about to end. She's like, her AMH factor is very low. Does it happen at this young age?
Yeah, it happens. We call it as like for them that ovarian reserve will be very less. Their ovulation, everything ends like what we expect usually is around 40 years, 40 45 years. For them it ends like prior to that. So in those conditions, premature ovarian failure we call. For them, if AMH is coming down, that's what previously also I told. Like irregular periods, don't think always PCOS. Nowadays, because of stress and so many other factors, we are seeing these cases also more. And then those cases we should like treat them vigorously. It is not like they don't have much time for conceiving naturally and all. Better to freeze their embryos as soon as possible. And then if AMH is low, if it is coming down, because the rate of the falling in AMH also will be more in that patients. So as soon as possible, if we detect those conditions, better to freeze those embryos. And if they are not ready for the pregnancy, if at least if their embryos are frozen, later also they can come for the implantation, like transfer, embryo transfer. But better to freeze their embryos. Better not to waste too much of time, and better to consult infertility specialist. That is very important in those conditions.
Okay, thank you, doctor. We have one more question. I was pregnant naturally, But then because I had a travel to my hometown, I had a miscarriage. So is it like I have to take complete bed rest in the next pregnancy?
No, I think this we pretty much covered in our previous conversations. So we cannot directly say that the travel has led to the miscarriage. There could be some other reasons, or it could be just a one-off. So we better investigate further to see if there are any known reasons for the miscarriage other than the travel she's thinking, and if there is any chance of recurrence based on this test. If all the tests are fine, I think, I mean, she can try naturally, I mean, within no time, and probably she needs to be careful with extra support or the medicines as suggested by her gynecologist. Avoid long journeys, rather like totally avoiding the travel or having complete bed rest.
Okay. Thank you, doctor. There's one more question. Is there any specific medication or a pre-medication that I can use to make my baby healthy even before I'm pregnant?
Yeah, so like I was talking in the preconceptual counseling, we can suggest prenatal vitamins. So these are certain vitamins which have to be adequate in the expectant mother, so that the baby will have these in adequate amounts and they won't have birth defects, or so that they are born more healthy. Most important one is folic acid. So whenever a couple is planning for pregnancy, whenever they think they should have a baby, it's better the woman starts this folic acid. And other vitamins which are important are calcium and vitamin D. Because of our current lifestyle, we are not exposed to sun much. Vitamin D deficiency is a very common condition we see now. So that has to be supplemented in adequate amounts. And calcium either through diet or supplements. If they have deficiency or any symptoms, calcium tablets also can be taken. Along with this, there are many fancy supplements which are available nowadays under various names. But folic acid, calcium, and vitamin D, they should look out for always.
Okay. Thank you, doctor. And there's one more question. Um, what age can I start for planning for pregnancy? I'm not yet married. Listening to all these problems, I'm a little scared now whether I'll be pregnant or not. So, yeah, are there any solutions for me to avoid this infertility issue?
I think we painted a very gloomy picture for you. That is not the case, but
I think we wanted to increase the awareness, nothing else. It's not to scare anyone. It would
So
have
maybe
been,
if
I
in
mean,
case,
useful if she has given her age, though.
yeah,
Some people,
then we
even though
have,
if they are 30, they think they are very young. So better to
yeah.
give their age.
maybe if in case they want, they can go for oocyte freezing if she's little
Yeah.
Oocyte
scared about it.
preservation is always there. It is called fertility
Yes.
preservation.
Yeah, if they
So
are
they
so
can,
scared, and then better to freeze their eggs. It is not like that if their frozen eggs are there, they have to go through the IVF. They can try naturally also. If it is not happening, that is there always like a backup.
There
correct.
is no actual cutoff, ma'am, for for them to get pregnant. But according to the data we have, once they hit 30 and more so after 35, the eggs will fall down drastically, the number of eggs. So if possible, if they're already married and if they want to have a child, then they can think of having a pregnant. They can think of getting pregnant, before 30, if possible. If not, also embryo preservation or oocyte preservation for women who are not married is a very valid option. And this will, having awareness is very good. Actually, it's a good question to ask. So
Yeah.
they can freeze their oocytes, and like Shreeta ma'am already said, they do not have to always go for ART or IVF if they have their oocytes. Then their backup, in case situation becomes bad, then they can use these. So, but yeah, 30 and 35 are some milestones we should remember, a woman should remember when she's talking about her fertility.
In fact, even unmarried women, they can come for our fertility evaluation. So we
Yeah.
can see like whether it is like age accordingly. So we can advise they don't need to worry. They can also undergo certain hormonal test based on which we can give them proper advice.
Okay. Thank you. I think that will help a lot of people.
Yeah.
There is running short of time, so I'll ask you one last question. And if audience have more questions, you can always drop a message in the comments, and a team would definitely respond back. The last question is: I'm a single male. Uh, I've been divorced, and I'm not looking for getting married again. So, is it possible to have my own child through any of the procedures?
No, single men, they cannot go for the any of the procedures.
That rule actually came
That
in
rule
only
is,
recently.
yeah, recently that
Before
rule
it was
came.
not so strict, but right now, at least for some time till these rules change again, we cannot provide ART services to single men.
Okay,
But
but
that's
is
not
it
the case
possible
for
for
single
single women?
men. Yeah, yeah. For single women, they can. They can go.
That's what it is shown in recent movie also. Like I
Yeah.
think everyone has seen that movie.
Yeah.
Yeah,
Correct.
but so many things
Mrs.
are
Shetty,
actually.
Kohli Shetty.
Yeah,
Mrs.
yeah,
Shetty,
yeah.
Mr. Kohli Shetty. So, yeah,
Correct.
I wanted to ask that what is your opinion on that, doctor? Is it possible? Do you really see patients like that?
Very less in India, but other countries, yeah, they are doing that. But the only one thing is, if they are giving for the sperm, coming for the sperm donor, we don't treat them like that. It is not like that. What is it? It was shown in movie, and then strict restriction in food and then activities, all those things. Because after saying that, people will think to donate the sperm. It is not like that. Actually, it is like so many couple they are suffering, like because of that. When my male partner is not having any sperm and all, and then that is like one. If they are giving their sperm, it is like they are giving one happy kid to them. It is they are giving life to them. It is other
Wow.
life to them. It is not like that. We don't treat the donors like that. Don't think that the infertility centers treat donors like that. And then
Correct.
no one knows that you donated the sperm also. That is the
It's
one thing.
equivalent to blood donation, like you are,
Yeah.
I mean, giving a life to the childless couple by donating the sperm. It's not like comedy, like what they have shown in that movie. It's actually a serious thing.
Yeah.
I think it brings a lot of happiness to some couple.
Correct, correct.
Yeah.
Yeah,
And they will be given more respect than they basically
correct.
think.
It's not for their convenience, it is the necessity. Because
Necessity.
husband have no sperm, that is the only way they can conceive. Yeah.
Recently, one of my friend was asking me, with this kind of movies, is there a chance that women doesn't want to get married and go through such procedures in the future? So I
I
think
mean,
we should
we
do
don't
one
encourage, actually, we
webinar.
always encourage natural way things. That's why you can see, being an infertility specialist, we are giving webinar on how to increase the natural pregnancy chance. That's the same thing. Whoever comes to us with all this, first we'll do a detailed counseling. First, we'll try to convince them, probably, yes, why don't you go for the natural ways? Still, I mean, if they are not agreed, they're mature enough to decide, we help them in a decent way.
I think with this movie, there are so many contradictions and so many questions in a lot of people. Maybe we should do a webinar exclusive on that particular topic.
For pollution.
That these days, people know that we are working in fertility centers, and all the questions are around that topic only, around that
Correct.
movie. Maybe we should do
Yeah.
that.
Yeah.
Thank you so much, doctors. Like you have given a lot of insight to all of us, and I think from what I understood is when you're planning for a natural pregnancy, it's important to make some lifestyle changes, and it is always better to have a preconception counseling and take the right steps in the right way, and you don't need to worry about it. And only when there is a problem, they need to take help of a doctor.
Right.
Summed up very nicely, Dr. Pushpa.
Okay. Thank you so much, doctor. Probably we'll see you again in the next webinar. And audience, if you have any doubts more, you can always drop message in the comment below. And our hospital people will definitely respond to you back. Our doctors will give reply themselves. And if you still have doubts, you can always call us to our hospital directly. Thank you
Thank
so
you.
much.
Thank
Thank
you. Thank you,
thank you.
Pushpa.
Thank you.
Thank you.